nurse practitioner in rural Illinois, and I'm bringing you a podcast about good health and its risk. With that in mind, welcome. This is episode 1 of In Good Health. My goal for this is to help make healthcare more attainable for everybody and to help some people with some basic understanding of different health conditions. Today, episode 1, we're going to start at the very beginning, primary care. Why do I need a primary care? What does it mean? So your primary care is what a lot of people will call your general practitioner or your personal doctor or your family doc, family medicine, pediatrician. These are the people that follow you throughout the years. They see your chronic health conditions. They may see you for acute conditions. And let me step back. So your acute conditions are really things that are bothering you right now. They're limited. They're not going to last a long time. Sometimes they change, but for the most part, strep throat, the flu, a broken bone, those are acute conditions. Chronic conditions are things that last a long time. They're lifelong. They're diabetes, they're COPD, they're high blood pressure, although that can be changed. The primary care is with you through the whole journey, and some of these primary care people will actually follow you as a kid and as an adult, whereas others only see adults and others only see kids. Generally, they're your one-stop shop for everything. What do? The main thing, I think, is disease prevention. So not only are they monitoring for all of these chronic conditions and they're helping you with acute conditions, but they're going to help you prevent disease. Things like immunizations, things like good diet, things like nutrition, things like exercise. What are your risks for different diseases and what can you do to change it? And your primary care is your partner with that to help you figure out, what can I do to keep myself healthy? What can I do to be healthier? Always in life, it's easier to prevent things than to treat them. And the same goes for healthcare. Healthcare prevention hopefully stops us from being sick and helps us to stay healthy or get into a healthier place. And that's really where primary care comes in. The other thing is general wellness. They're going to look and they're going to see overall, how healthy are you? And naturally, most people think about things like weight or smoking or things that are not very fun to talk about. And that's certainly some of the things that we deal with. But overall, we want to look at your mental health, your emotional health, your social health, your physical health. What kind of things are modifiable to help your disease risk, to help you live a healthy life? What are those things that can be modified, and what can you do to modify them? And that's our job, is to help you be well, in good health. Again, we talked about treatment for acute conditions. If you break a bone, if you think you have strep throat, if you have influenza, heart attack, these are all things that primary care can help manage and make the appropriate referrals to a specialist or to give you the possible treatment to end these acute conditions, like strep throat. Here's your amoxicillin, it's gone. They also help treat chronic conditions. Again, diabetes, high blood pressure, COPD, seasonal allergies. These things bother you over time, and they're not going to go away. They're not going to get better. Again, blood pressure to a certain degree we can treat, but that's another conversation for another time. These conversations last your entire life. And because of that, you need somebody in your corner to help you treat it. Is it under good control? Is it getting worse? Is it getting better? Can you come off of medication? And there's complications. High blood pressure can lead to heart problems in the future. So we're going to help monitor for those heart problems. We're going to try to help keep your blood pressure in a goal that keeps you healthy and minimizes your risks. The other thing is, like I talked about, primary care helps with referrals. If you break a bone, obviously, I can't repair that, but I can make a referral to an orthopedic doc of your choice who can repair that. If you have COPD and I'm trying to control it and it's a little bit difficult, it's a little bit complicated because everybody's different makes and models, then I can refer you to the pulmonologist. If you have a heart attack, I can refer you to the cardiologist. And I'm going to help coordinate with all of these people so that we don't run into a situation where there's too many cooks in the kitchen and you're left confused and I'm left not knowing what somebody else is doing or vice versa. We're going to work together to coordinate your care and take care of you holistically, the whole picture. And that's what the referral process basically consists of. The other thing is behavioral or social modifications. Now, that sounds scary on the surface, but what I mean by that is if there's certain things in your life that's affecting your everyday life, anxiety, depression, worry, panic, fear, smoking, drinking too much, exercise or not exercise. These are all things that are part of who you are, but they can affect your overall disease risk and your future risk for disease. These are all things that we can help modify or tweak to get you away from those behaviors that are going to make you ultimately less healthy, those things that are going to bring disease into your life. And a lot of times, once these diseases, we'll use alcohol, for example. If you are drinking too much, this can lead to liver damage. A lot of times, once that liver damage is there, it can't be reversed. So our job is to help recognize those social, those behavioral factors that we can control, you can control, to help prevent disease. Smoking, it's a big thing. Everybody knows about it. My job is not to ride your ass and make you decide to quit smoking. My job is to tell you the risks, to tell you the benefits, and then it's your life, it's your health. You get to decide what you want to do. I'm going to tell you what I think is best. That's why I'm here. But ultimately, it's your life and these decisions are yours, okay? Unfortunately, the consequences are yours too. The benefits of having a primary care provider, as I mentioned, there can be that long-term relationship. Think about your family or your friends, people that have known you your whole life, maybe your spouse, people that you've known for a long time. They know you so well. Sometimes those people know you better than you know yourself. Now, I'm not going to be bold enough to say that I'm going to know you as well as you know yourself, or even better. But somebody who follows you, especially if they follow you from childhood or young adulthood into the time of you reaching an older age, they know you. They know what you've been through. They've celebrated your successes. They've been there with you through the downfalls. They've seen the progression of your health from here to here and why it got to be that way. They can help monitor for those diseases, and if there is some kind of disease, hopefully catch it early and help you with treatment. That long-term relationship, having somebody in your corner, is beneficial. A lot of people think about it with their plumber, their electrician, their car dealership. I always go to the same place because they treat me well, and that's great. Shouldn't you have that for your health? Have somebody that you can trust, and that's the big thing. Trust in this world is really hard to come by. We all know that, right? It's hard to find somebody that you trust. People are mean. Find somebody that you do trust. Somebody who is going to help you take care of your health. Somebody who is going to partner with you and keep you in that healthy mindset. Somebody who's going to help keep you from getting chronic diseases, or at least minimize your risk of having chronic diseases. Somebody that you can talk to. Somebody that you feel empowered enough to say, I don't agree with this plan of care. And somebody who's going to be flexible enough to say, okay, how can we change that? What don't you like? And we develop this plan of care that works for you, works for me, and follows you through the lifetime. And that's going to need updated from time to time. If you bounce from provider to provider, or you use a walk-in clinic or a convenience clinic for all of your healthcare needs, that's not ideal. I mean, it works, yes, but it's not somebody who's following you long term. It's not somebody who knows you for who you are. It's somebody that's seeing you at a moment in time. And again, we have this person we trust in a lot of different ways. You have a plumber you call all the time. You have a car dealership you call all the time. You have a friend that you know that you can talk to, or a brother or a sister, somebody that you can rely on. So find somebody that you trust with your healthcare. And make sure that person's honest. And look, there's been a lot of distrust and dishonesty when it comes to the medical field over the last couple of years. And I'm not trying to get political, and I'm not trying to get into this situation where we're talking about malintent. We'll leave it at that. But I have seen people in healthcare celebrated as heroes, and I have seen people in healthcare portrayed as villains. There are no ulterior motives here. Maybe for some people there are. There's bad apples in every bunch. Our goal is to keep you healthy. Our goal is to make you mentally, socially, spiritually, physically, as healthy as you can be, and to stay that way. I'm not out here getting any type of kickback for anything else going on. I'm here to help you. And to do that, I'm going to be honest. I'm not going to give you everything you ever want. I'm not going to agree with you. I'm not going to make everything all rainbows and sunshine and make everything okay. But I'm going to be honest with you. Hey, this behavior is going down a bad road. This is going to set you up for some major complications. You don't have to change it, but this is going to happen. And again, these decisions are yours, so are the consequences. But I'm going to make sure you know what those consequences can be. And then I'm going to help you when you get there, because this is your life. I'm not here to judge you. I'm not here, primary care, we are not here to try to force you into this image that we think you should be. We're here to help you make the decision to live a healthier life. Again, if you're with a car dealership, you want somebody that's honest with you. They're not having an ulterior motive trying to sell you the car that's giving them the biggest bonus. They're not trying to get a car off the lot that nobody else has been trying to sell. We're not snake oil salesmen just trying to peddle something on you. Because I'm going to tell you, and hopefully we find over the course of this podcast, my job is not to push pills. Are there medications in healthcare? Absolutely. There's benefits all across science. That's the point of science, is to hopefully make our life better. Medications are no different, but there's not a pill for everything in the world. I'm here to help you, and I'm going to use the things that help you the most. Primary care is going to use the things that help you the most, and we're going to be honest about that, and that's why you can trust your primary care provider. If you can't trust them, I recommend following a different primary care provider and finding one that you do trust, but give them a chance, okay? Have those open conversations about your health and find somebody that's willing to partner with you on this journey. Now, there's roadblocks to primary care. I know that. Part of it's going to be the cost. You may not have health insurance. Most people do. Maybe you have a high deductible. Maybe you have a large copay. Maybe you just don't have any money to spare. Hey, I've been there. All right? We've all been there. But making an investment in something is a huge, huge benefit, especially when it's something as important as your health. We all know that time is a precious commodity. We're all only given so much. When it's up, it's up. You can't buy more time. You can't rewind time. You can't fast forward time. Health is a lot of the same way. You can't buy good health. You can't change poor health sometimes. Sometimes you can. And that's another reason why you should be here, listening to the primary care, benefiting from the primary care, getting the help that you need to live that good life. Yes, there is a cost associated with healthcare. I personally hate insurance. I personally think that healthcare is wildly expensive for everybody. But making an investment in your health is something you're never going to regret. Another roadblock is that people don't know where to go. And that makes sense. Where do I start? I want a primary care. Where do I go? Talk to your family and friends. Who do they see? Who do they recommend? Who don't they recommend? Look online. So anymore, there's patient surveys associated with every hospital, clinic, doctor, provider that you will ever see. And those are public knowledge. There's all kinds of websites, and I'm not going to promote any of them. I'm not going to say them by name. But you can see actual ratings by patient surveys regarding healthcare that they have provided. And you can do your research. Worst case scenario, you make an appointment with somebody to establish care. You don't think it goes very well, you don't gel, you don't vibe, you don't really like their bedside manner. Find somebody else. You're allowed to say, hey, this doesn't work for me, and you can go somewhere else, okay? But just do your research and start. Again, same as buying a car. Do your research, talk to the people around you, find one that works for you, and stick with them. The other roadblock that I typically see when it comes to establishing primary care is fear. I've heard a number of people say, I'm afraid to establish care. I'm afraid to go see a doctor because what if they find something bad? I get it, okay? I've been the patient. I've been on your side of things. I've worked in healthcare for 15 years. I have seen every side of this, okay? Fear is real. But I assure you, if your primary care finds a scary diagnosis or finds something wrong, it's already there. We're not creating it. We're helping you find it, and then we're giving you answers and how to treat it or how to live with it. Ignoring a problem doesn't make it go away, and you know that. Just because you don't go to the doctor doesn't mean that something bad is not there. You may have diabetes. You might. I hope you don't. You don't know unless you go to a doctor and get that figured out. And if you do have diabetes, that's terrible, and I'm sorry, but we can help you treat it. We can help you with treatment and lifestyle interventions to help you live the healthiest life you can with diabetes. If you have diabetes and you don't get diagnosed and you don't know, it will lead to complications. You can lose your eyesight. You can lose parts of your body. You can lose your kidney function. You can have urinary tract infections. There's a lot of complications that go with untreated diabetes. So seeing the primary care doesn't create the problem. Yes, the unknown is scary, but the unknown is only scary because it's unknown. Once you figure it out, you are empowered with a way to move forward. If you don't know, it stays unknown and it stays scary. Again, this was a very brief episode. I just want to touch base on primary care. Again, this isn't a self-promotion. I think that any primary care provider would agree with the things that I have said. I think that most people in our society can benefit from a primary care. And look, I'm a hypocrite. For a long time, I had a pediatrician. When I turned 18, I quit going to my pediatrician, and I didn't have a doctor again until I was in my 30s, even though I told everybody else to go get a doctor. But having that primary care provider, and again, that can be a nurse practitioner, that can be a PA, that can be a doctor, having that person is huge. Even if you think that you're healthy, and you may be perfectly healthy, they help monitor for those things that may come up, and maybe we catch something early. So even if you think you're in a great state of health, establish primary care, go to your annual visit, get your labs, have them give you a pat on the back and shake your hand, and we'll see you next year. And at least you know. Again, the unknown is scary, so don't set yourself up for the unknown. Know what your health looks like, empower yourself to treat it, and live in the best health that you can. As we go through this podcast, I'm hoping to visit certain diagnoses, treatments, medications that a lot of people may come across and break it down into a basic level that everybody can understand. I want to make healthcare knowledge attainable for everybody that watches this. Again, I'm not here to diagnose, I'm not here to treat, I'm not here to give you health advice. I'm here to talk about a subject and give you a better understanding of it so that you can be empowered to take care of your own health. These episodes will drop on the Facebook page. There's also a TikTok. I don't know how active that's going to be right now. I don't know what this looks like. I'm just figuring it out. But I hope that the next time that we see each other, I find you in good health.